This tutorial will go over the setup and registration of a image guidance endoscopic sinus surgery system. We do not endorse or recommend any specific product. This is just the product that we use at our institution. We have just inserted a CD which will auto-run if it is in a correct format. It requires DICOM formatted uncompressed images. Occasionally we have had problems with viewers being on the disc, however this has not normally been the case. Import options will pop up on the screen after the disc is recognized. The import options are shown. At one of our institutions we use a GE scanner. If you don't know or are unsure, then DICOM standard formatting will usually work. The unstructured DICOM will work with the widest array of image data sets, but it takes the longest to upload. It is important that the image guidance CT scan has all the following components. It needs a 0-degree gantry angle. It must include all of the frontal sinus. Both ears should not be compressed or distorted. It should include the maxillary teeth and have as thin of slices as possible, less than 2 millimeters. You will then upload the appropriate scan. It should have between 200 and 300 slices available. At this time, you will then select the exam you would like. You need to select the one with the most images. You may need to scroll down to find this. Here, the exam has 137 slices. If you choose one with the not enough slices, the exam will be grainy as you can see here, and the 3D model will not be sharp. By choosing this CT scan to observe in a better 3D model. Here you can see the end result, a well-detailed CT scan in all 3 planes. Additionally, a nicely formed 3D model. At this point, the CT scan can be adjusted to your liking, whether changing the contrast, zooming in, or moving it to centered in the screen. The 3D model can also be adjusted by sliding the toggle bar. We can adjust it to remove the backboard so that only the face is remaining. There is no optimal setting. This will vary with each individual scanner. At this time, we are now ready to register our points.
And you have 2 choices here. You can either choose point merge, or you can go to tracking. I always do point merge because I get very good detail in the sphenoid, which I find is the most concerning part of the surgery. This is what I was trained to do. So at this point we're going to go through and show you how I select points. We're going to use, the first point we're going to do is the juncture of the antihelix and the helix, so the inferior crus of the antihelix. So here's your antihelix going up as an inferior and superior crus. You do the inferior crus where it connects up with the helix. And these are important because they're very, very difficult to get landmarks on the face that correlate between CT scans and actual physical findings that you can point out with image guidance. So here you see on this coronal the juncture of where the antihelix and the helix just crosses over it, and you can see I'm climbing up actually on the sagittal until I see a solid bar here on the helix, and then I usually am going to pick a point just about a millimeter in, because when we rest our probe on the skin it'll be pushed in about a millimeter. I'll store that. The next one we're going to do is the tragus antitragus. Again, I'm going to look over here and you'll see that I'm looking on one scan and I'm always moving on another. And so I'm going to look at, I'm trying to find the point at which the tragus and the antitragus square out right there. And you can see on here I've chosen that point. Next one we're going to do is the medial canthus. This is a nice scan. You're going to pick right on the caruncle is what you're aiming for. And you look here on the coronal, and you're going to choose on the axial and go until that air kind of just disappears, that air pocket disappears right there. And you can verify right here that you have a really nice selection of the caruncle. The next point we're going to do is the nasal sill, where the ala on the internal or medial portion of the ala and nasal sill, and it's right there. And so what I did is I was working off the axial, but I'm actually watching over here on the coronal, and I'm waiting to see this turn into a solid bar right on inferiorly. Once I see it turn into a solid bar, I mark the medial point at which the ala and the sill come together, right there. So we're just going to do the same points on the other side. So I'm going to be watching here while I'm dragging over here. I'm going to go to where it just turns into a solid bar on the sill, and I've got it perfectly right there. Now I can cheat and go up to this one, pick the caruncle. You can see there's an air pocket right here, so I'm actually going to drag off the axial and wait for that air pocket to disappear, and there I can see perfect. Now I'm going to go back to the ear, and here we reverse them because we're always going to go top to bottom, just because that's our convention. You can do it however you want, but you always want to make sure it's the same every time. So again, I'm gonna march up the inferior crus on the sagittal, but I'm watching the coronal until the helix becomes solid. Alright, so now it's fairly solid. I'm just going to pick that point. I can double check to make sure it's correct right there. And then the last one I'm going to do is the tragus antitragus. I'm going to be watching on the sagittal and be moving the coronal until I see this square out like that. And it's 1 millimeter in. The last thing I'll show you is how do we actually put on the device. We actually put a piece of double stick tape right here on the forehead directly. We don't use the metal mounting probe. We just put a piece of double stick tape right here, leaving enough room for mini trephines if we need to in the eyebrows. And then we're going to put the patient tracker right in the middle of that double stick tape, and then put another piece of double stick tape right over it. And then that'll be how we mount. And we work from there. Alright, that's how we do it.